What we're going to focus today, and this is what I want all of you to get out of this discussion, learn about the three major factors that significantly increase the risk of dementia, and then what do we need to do about it, and what are the two major supplements from an evidence-based approach that your patients can use to continuously improve their cognitive function, right? On a personal level, so we got some experience with utilizing the functional and nutritional and herbal medicine that we want to share with you today. My experience with a family member, my grandmother, who was there for me when my parents were working with two jobs and as immigrants who came in and had nothing to start with. And my grandmother was the one who was there for me so she was sort of like a second mom. And she was very smart. She spoke multiple languages, French, Spanish, multiple languages, very social. And we've seen that from the symptoms of declined memory within a few years to the full spectrum of dementia and Alzheimer's, which she no longer recognized other family members, myself. It's a very painful event to go through that. Through years of investing in learning functional medicine and nutritional medicine, that when my father started developing those symptoms, that was about 10 years ago, 8 or 9 years ago. And we all knew what it meant, right? And we know that there's genetic predisposition with these conditions. And we just didn't want to wait and see what happens, or wait until he qualifies for the drug, and then we know the path that he's going to go through. So he flew in to our practice. We worked with him for several months, and then within about 6 months, we were able to reverse his symptoms 100%. So it was quite remarkable. It was a very significant change. And now he's 80 years old and he's enjoying his retirement. He travels with my mom. So that's what I wish for all of us, these success stories, for all of you to have in your practice or with your family members, of how you transform their health. There's a few reasons why it's important, but that I wanted to share why it's really important for me personally to educate as many healthcare practitioners about the different treatments that are offered beyond the standard of care. Worldwide, there's over 55 million people with dementia. The number keeps increasing. In the United States, it is estimated that in older Americans above the age of 65, 1 in 10 older Americans have dementia. So it's very common. And as healthcare practitioners, we do believe that when a patient comes to see you and they struggle, providing them with additional treatment strategies to continuously improve their health and looking into the root cause is very, very valuable. It's valuable to the point where it could save some patients' lives. So it's very common. We all need to have a good understanding of how to treat it. The second reason is because dementia medication can be effective for some people, typically don't work for long. As the effect of the medication slowly reduces, the patient unfortunately continues to progress with their symptoms and the damage that is done, the neurological damage that is taking place.
There's so many factors that aren't being discussed, and I'm glad that we are going to discuss those factors. So in the inflammation in the brain, there is a term for this. It's called neuroinflammation, and it has been identified and associated with many conditions, including dementia, mood disorders, and neurodegenerative conditions. So let's take a look at a picture really quick. And this is from the International Journal of Molecular Sciences, and this was published in 2022. So here we can see in the image that when a person is exposed to a neurotoxic agent, right, we see that in the picture here, it's going to stimulate the microglia, and then it's going to activate them. This is going to lead to activated microglia, and it's these immune cells in the brain that respond to injury. We see that here again, or infection, and this is going to release cytotoxic substances, and this is going to clear damaged cells and then attack the infection. While activated microglia, these are important for your brain health, they can become stuck in an activated state. And that this is going to release cytokines and reactivated oxygen species, or ROS. And this could lead to the damage to our brain cells. And then over time, this can lead to neurodegeneration. And this is the whole premise of this picture there, from the factors all the way to neuroinflammation to neurodegeneration. And it's these neuroinflammatory responses that have an immune, a physiological, a biological, a biochemical, or a psychological effect. And aging and our genetic predisposition, as Dr. Cohen was talking about, this could place us in a more vulnerable situation to develop cognitive decline. But there are modifiable risk factors such as our diet, our lifestyle, the environment. All of these have a play, and they have a significant role in developing neuroinflammation.
So let's talk about one of those factors. I know Dr. Chill mentioned environmental factors, metabolic, mold toxicity. One major factor, which is factor number 2, gut-brain axis. And you can see here in this picture, you can see the different pathways, right? And we're going to start from the bottom right. You can see the connection. There's multiple connections. There's one connection through the vagus nerve. But here, what we're seeing on the bottom is how changes in the gut microbiome. And there are very specific, there's very specific data that shows that some gut species of bacteria can lead to stimulate more inflammation. They can change our metabolism, right? While other can prevent that from happening. So if your patient has what we call dysbiosis, there's going to be some metabolites that will be secreted, some inflammatory reaction, and that could cause increased react oxygen species, right, for free radicals. And then that inflammation will impact the permeability of the gut, right? So we got those tight junctions. Let's say this is a gut cell and this is another gut cell, and they're connected together. And in the middle, we have that tight junction, which is the door that opens and closes things and prevent things from going from outside of the body, which is in the lumen of the intestine, sliding or leaking into our bloodstream. If there is dysregulation of those proteins of the tight junction, right, because of inflammation, secretion of zonulin, whatever it is, those can slide through. This is what you see in the left corner in the bottom, increased gut permeability. Problem with that is that it leads to LPS, those are lipopolysaccharides, right? And lipopolysaccharides essentially are the major component of the outside of the membrane, the outer membrane of the gram-negative bacteria, right? So as these bacteria and lipopolysaccharides are sliding through the gut into the bloodstream, right, they bind to the TLR receptors. Those are toll-like receptors, typically toll-like receptors 4, on monocytes and microglia, and they start increasing the level of pro-inflammatory cytokines. So that can happen continuously, right? And that's one of the factors that leads to neuroinflammation and damage to the neurons and cognitive decline. There are multiple issues that are associated with lipopolysaccharides, right? It's really important to know how to measure those. There are different ways to measure that. You can measure lipopolysaccharides antibodies in the bloodstream, for example, to see what's the reaction of the immune system. But there are 2 or 3 major issues with those lipopolysaccharides. One, increase of lipopolysaccharides in the bloodstream would cause an inflammatory response, right? In fact, some of the published articles show that it will bring forward a very strong immune reaction. Second, lipopolysaccharide can cross the blood-brain barrier to some degree, but in small amounts, right? So there's one really interesting animal study. They did an intravenous injection dose of lipopolysaccharides, and they found that about 0.025% of that crossed the blood-brain barrier. Now, only a small amount crosses, but that small amount will already will already bind to microglia, to receptors on the microglia, such as the CD14 or toll-like receptors 4, and that will activate signaling pathways that lead to the production of cytokines, type 1 interferons, and as a result, now you're getting an increase of reactive oxygen species and free radicals, which again causes damage to our brain. The other problem is that although we have very small amount of lipopolysaccharides that cross the blood-brain barrier, lipopolysaccharides over time can damage the blood-brain barrier function, which allows inflammatory and neurotoxic factors to enter the brain, right? So now we're even more exposed to those different neurotoxins. One of them, for example, could be heavy metals. So that's something, so it's really important to make sure that we figure out what's happening in the gut, if there's an indication for that. There are specific signs and symptoms for small intestinal bacterial overgrowth. There's specific signs and symptoms for dysbiosis. There's certain signs and symptoms of low amounts of beneficial bacteria, right? You can actually measure these specific metabolites, right? We have a whole class just on that, on measuring what's the levels of the inflammatory versus non-inflammatory, what's the immune system is doing in their gut, right? So there are specific tests that look into that, and we go into all these biomarkers and the pathways. And now we have another factor that is really important.
This has to deal with nutrient deficiencies, right? The evidence is showing that it's dealing with B vitamins. We understand that the importance of B vitamins. You might have had patients who have B12 deficiencies and they have a lot of fatigue or chronic fatigue because it's a form of anemia, particularly macrocytic or pernicious anemia. This is no different with neurological issues. Vitamin Bs are really important for cognitive function, and then deficiencies in this can be linked to neurological issues, including dementia. This is showing the physiological systems. We can see all of those systems here where B vitamins are essential, right? We see that these vitamins are essential for lipid metabolism in the gray there, the Krebs cycle in the red there, and this is important for mitochondrial function, where all the cells, including the brain cells, are, and then glucose metabolism, neurotransmitter synthesis, and epigenetic control. So how does all of this impact cognitive function and decline? So B vitamins, these are all tightly related to gene control for endothelium protection, right? We understand that their genes can be turned on or off, and nutrients are one of those factors that can turn these genes on or off. And with B vitamins, these can control the endothelium protection. They can act as antioxidants. They can play a coenzymatic role in the most critical biochemical reactions. This all happens inside the brain. And then they couldn't cooperate with many other elements such as choline. And this is all responsible for the synthesis of polyunsaturated phosphatidylcholine. And this happens through SAMe or S-adenylyl methionine donation. And this is all important for the brain cell structure and the function of those brain cells. Now, B vitamins also have an anti-inflammatory property, and they can act as protection against neurodegenerative mechanisms. For example, they can modulate the glutamate currents and reduce all the calcium currents that can damage the brain cells and cause neurological dysfunction. So we now see that nutrients such as B vitamins are needed for neurological health.
And this is where we transition into talking about supplements. And the reason why we talk a lot about supplements is because while we do talk about dietary and lifestyle medicine and all of that, for many of us, not just patients, but many of us, it is easier to take a pill or a capsule or drink it in a formula or drink a powdered formula or a tincture than completely changing our diet. Many of our patients are taking supplements. Statistically, 7 out of 10 adults in the US are taking supplements. So patients are already conditioned to take pills or capsules. It's an easier approach. Now, when patients start seeing improvement in their symptoms, they're going to be more and more open to the dietary and lifestyle changes as well.
What kind of supplements can handle neuroinflammation in multiple ways, right? And when we're looking at these supplements as well, can these supplements be a big needle mover for the patient's health? And one of those supplements is curcumin. There are over 1,000 published animal and human studies, both in vivo and in vitro, of curcumin and the effects of various diseases, including Alzheimer's, dementia. The effect with curcumin is that it can reduce beta amyloid plaques, which has been shown to be one of the contributing factors for neurodegeneration. It can protect the neurons from degrading. It can help with chelating metals, which we slightly talked about in the beginning. It helps to reduce inflammation, and then it acts as an antioxidant. And then it can also inhibit microglia formation, which we also discussed earlier as well. And then it's been shown not only to be that protective through those various factors, but it's also been shown to enhance overall memory in patients with dementia. Now, the studies are showing that memory deficits at dosages of 20 and 50 milligrams per kilogram, this is while it's been administered, this can be shown to reverse memory impairments, and this is all a dose-dependent manner. And then with the higher doses exerting a more beneficial effect. This is at the 50 milligrams per kilogram. But the daily dose of curcumin for adults can range anywhere between 80 milligrams to 2,000 milligrams. And this is generally what's considered safe. And then you can also look at doing 100 milligrams to 500 milligrams twice a day. What we would recommend is to start with a lower dose and then slowly increase their dosage to see what their tolerance levels are. But as I was stating, when we're looking at supplements, we're looking at a supplement that can have multiple features to it, right? So with the curcumin, it's the beta amyloid plaques, protecting the neurons, the chelating metals, reducing the inflammation, acting as an antioxidant, inhibiting microglia, and then enhancing overall memory as well.
And that's a really good recommendation. And one thing that I'll add to that is that curcumin, there are some products that are better out there. And we have a whole list in our clinical guide of what's considered professional grade and those supplement manufacturers and vendors that have good manufacturing practices certifications, the GMP certification, and also they're third-party tested. Give you an example, Pure Encapsulation is one of them. Douglas Laboratory is another one, and MediHerb is another professional grade supplement. So make sure your patients are taking supplement grade. Otherwise, they're either taking fillers or they're taking capsules that might have other things that are undesirable. They're not going to get the results that they're looking for. So that's one thing. And the second comment I wanted to mention, that curcumin has a relatively lower bioavailability. So to increase the availability of curcumin, just look for a product that has piperine. Essentially, it's the active ingredient in black pepper. And some products already have that together. It's combined together, like 5 milligrams of piperine together with curcumin, right? And that was found to significantly increase the absorption so you get more of a systemic effect rather than just an effect in our gut. So let's go into the second supplement, and that's ashwagandha. Another name for it is Withania. And there was a really interesting prospective randomized double-blind placebo-controlled pilot study involving 50 subjects with mild cognitive impairment. One group received 300 milligrams twice daily of ashwagandha root versus the other group that received placebo, and that was for 8 weeks. Now, it's really interesting to mention that most studies will look at a minimum of 3 months. So we'll see what type of results this particular study have got, because it was this would be considered a shorter term. But after 8 weeks of study, the ashwagandha treatment group demonstrated a significant improvement in both immediate and general memory tests when compared to the control group. Furthermore, the treatment group showed a significant improvement in executive function, sustained attention, and information processing speed. So, wonderful protocol to consider when you are working with patients that have challenges, that have cognitive challenges, maybe initial stages of dementia. So that's something that you can look into. There's another interesting study that I'll mention here. I just wrote an article a couple of weeks ago about treatment strategies for head trauma, and ashwagandha was one of those protocols that showed improved recovery from head trauma. Right, so the dosage was 300 milligrams in this particular study. As usual, we want to make sure that we take under consideration the patient's medication. So if they're on blood thinning medication, for example, then we want to go with a very low dosage and monitor them throughout time, right? Monitor them every week or 2 weeks to make sure that we keep in that balance with the coagulation factors, right? And sometimes I would start with a patient with just 50 milligrams a day, right? A small amount if they're on taking multiple medication, just a small amount, longer term, while I work on the underlying causes, root causes, and slowly integrate some, maybe every week or two, integrate one nutritional change and one lifestyle change, right? So that could be, for example, this week, can you add 10 minutes of walking after doing your lunch break or in the evening, right? 2 weeks later, can you add another one vegetable to your dinner, some sort of vegetable that is not potatoes to your meal? So what I've learned that works best is to utilize those protocols because they're very strong. And you can see here there's significant improvement with both protocols while working on the root causes, while slowly, very simple and slowly introduce just one nutritional or one lifestyle factor to your patients, right? If we overwhelm, then I made that mistake when I first started working with patients, I would walk in and say, talk to them about their initial stages of dementia and what their health goals are. And then I would say, okay, we're going to reduce exposure to this. We're going to do this. We're going to remove this from your diet. We're going to cut all the sugar. We're going to do this. We're going to do this. And they would be looking at me with their eyes like they're in the lights, right? We don't want to hand over our patients a list. I've seen practitioners do that when I shadowed in practices, and I've seen practitioners who hand over a patient guide and say, here you go. The patient just goes home. And while some patients might go home and they'll start implementing most of those recommendations, most of these patients would not. So what I would recommend is every visit is have a support member that comes with them, take some notes. That's really important. In my practice, we always had a support member, right? Especially when a patient have dementia, Parkinson's, initial stages of Alzheimer's. Always have a support member, their spouse, their daughter, their son, a friend, somebody that can take notes for them, and only ask them for one nutritional or one lifestyle changes at a time, right? And let them adjust to it. So that's just a few general tips to working with those patients. There's so much to learn about treating cognitive disorders, so much to learn about improving brain health.
Right. But these are just a few ways to begin with your patient, right? So a lot of practitioners, when they're doing the coaching sessions, they're always asking, how do I begin? There's so much information. And this is why we're doing these discussions, is to teach practitioners kind of giving them a starting place, and then they could dive into more information within the program.
And for any of you who wondered, how do I need to wait a whole year until I get certified with the advanced and clinical functional medicine program to start benefiting my patients? We're here to tell you that we have completely transformed our program. And for every practitioner who starts in our program, they get into the Quick Start program, where we give you from the beginning, we show you the foundation, we give you the clinical evaluation tools and the treatment tools, and you go on with one-on-one coaching sessions with Dr. Chill, and Dr. Chill shows you how to apply this in like real case studies. Like you can take yourself as a case study. I know Dr. Chill, we had quite a few practitioners, I think over 120 practitioners go through that Quick Start program, and a lot of them did their case studies. They took themselves through the evaluation, the functional medicine evaluation, right?
That's absolutely correct. They either did themselves, their family members, or they're already working with patients and they wanted to use the functional medicine approach right away, right? So then they'll send me the functional health survey. We'll go through that together. I'll go over the functional health survey with them, and then I'll guide them on what to do as a practitioner when you're looking at that functional health survey. How do you use this as a tool? How do you use this to guide you to figure out what labs to do, how to prioritize the labs, what treatment approaches to start with, right? And then as you're doing that over and over, you get to see the pattern of functional medicine and how to put this into your clinical application. And I have practitioners sending me their case studies on a weekly basis because they want to feel really comfortable in functional medicine. So by the time they're done with this program, they're good to go.
And that's what we're so proud about, giving you all the tools that you need. So when you get into the program, the clinical program, you're not just getting started and experiencing functional medicine from your first month in the program, but you're also getting the consultation forms, the legal forms, you get templates for marketing. We essentially provide the whole comprehensive approach, both the clinical and the practice building, because we want you to succeed. And we also understand that you're probably seeing patients right now who are chronic. Some of them keep struggling, and we want to offer them help as soon as possible. So this is why having those one-on-one mentorship and coaching with Dr. Chill is incredible, because you can benefit from that greatly, and your patients as well. And remember, we're with you every step of the way to get better and better clinical results, right? Become the health expert in your community, helping you get certified in functional medicine and build a successful practice. So thank you for joining. Hope you take care. And again, thank you everybody for being here.